Hello, everyone. Welcome to my podcast, MCF Psychology. In this podcast, we talk about mental health and psychology, of course. I am your host, Mary Chris. So, in today's episode, which is the first episode, by the way, we will talk about the purpose of going to therapy. So, first of all, I would like to talk about the misconceptions about going to therapy, about basically what is not what people think. Well, first, going to therapy is not telling your problems, your issues to a stranger, to a random stranger. It's basically telling your problems and issues to a professional in mental health that has the knowledge, the skills, and the techniques to help you to understand what is going on in your life, so that way he can help you. Going to therapy is not for crazy people. That is such a big misconception. It's very common. And honestly, in psychology, people really don't talk about, like, professional psychologists and the professional in mental health in general, they don't really talk about craziness like as a concept. There are different ideas, they are according to mental health books and basically manuals. So it's not like we can just label people freely as crazy. And yeah, that's something that is more related to the common language that people use. And yeah, so people that have no issues with, like extreme issues, people that are very functional, they can still go to therapy. um, because they have, maybe they have some mental health issues that are not so obvious to strangers, but that doesn't mean they're crazy. So another thing is that going to therapy doesn't really mean that you need to have a mental health like syndrome, because it's not like you're going to fix in a specific box. And the reality is that, yes, in manuals and books we have so many labels and lots of syndromes with and everyone have, and each of them has a list of symptoms so that the professional can diagnose easily. But the reality is that not everyone is going to fix into those labels. You know what I mean? Because the reality is can be even more diverse. These books are just supposed to be a guide for a professional. And yeah, so basically not everyone is going to fix, like I said. And it doesn't mean that you're not going to find a solution. The professional can still help you. And yeah, so about the psychology therapy, there are different reasons why you can go there. So the first reason is to reduce suffering, because you probably are going through, I don't know, maybe you're going through something very dramatic. You just had, like, I don't know, like a big loss in your life, or maybe you went through an accident, or you just like I said, you just lost, I don't know, your job, or you went through a broke up with your partner. So so yeah, basically going to therapy is a good way to reduce the suffering, because of course you can talk to your friends and they can help you with reducing the suffering, and they can make you feel better about the situation. But with psychology, with a psychologist you can get a different approach that can make you feel more relief. And some people they talk about this situation as ending a fire, reducing the fire. So the next point is learning how to control your emotion and thoughts that are usually the ones who create those and precede those emotions. So yeah, there are different techniques that you can learn. I think therapy it's a lot about discovering and learning. So yeah, basically some people they may struggle with controlling their emotions. um, there are different kind of emotions, so sometimes maybe you just have like anger issues, but some people they just don't realize, like I said like I said a few minutes ago. You can still be like a completely functional person and still be like on need of going to therapy. Another reason why you should go to therapy is to overcome your self-esteem issues, and this is very very important when it comes to mental health. I think self-esteem is like the core when we're talking about self-esteem, because it can prevent so many can prevent or be the cause of so many um, syndromes. Like for example, if someone has a low self-esteem, it's most likely to have depression, to suffer from depression. And also depression is related to anxiety. They're both related and they're both also nowadays very common. And and also low self-esteem is also related to having very poor social skills, which can also lead to depression. Isolation can lead to depression. And yeah, that's, like I said, another important reason. And as I said before, in therapy you can get to understand yourself and learn about yourself, and this is very important in order to also understand why you are the way you are. And you can also take decisions when it comes to change yourself. That's why it's so important. So we can say that um, self getting to know each other, getting to know ourselves, is also a purpose related to going to therapy. Learning about your skills, learning about your why you are the way you are, learning about your behavioral patterns, where do they come from. This is another reason why you should go to therapy. uh, so the next one, people can go to therapy when they want to talk about an traumatic event from their past that is still haunting them. So yeah, this is very important. I remember when I was a student, a teacher told us that not everyone that has been through a traumatic experience and goes to therapy is going to talk about it, because sometimes you have already integrate this trauma. I wouldn't say necessarily overcome, because sometimes you just don't overcome it, you just integrate it into your life. And yeah, so they basically just integrate it because it's been so long ago, or maybe after that traumatic experience they manage a way to integrate it and keep going basically. So then later on they decided to go to therapy, and maybe there is another reason why. So yeah, not everyone needs to you don't need to talk about each one of your traumatic experience all the time. But sometimes it happens that maybe it has been a long time ago, but you know that it's still present in your life. So yeah, going to therapy can be really helpful. So next one, you can go to therapy when you are in a moment of crisis. So crisis or transition, I think. Well, I've learned that crisis is not necessarily that like a bad thing. Crisis is mostly related to transitioning, to changing. But of course, this can be difficult. This can be very challenging for some people. And yeah, so going to therapy is like a way of finding that support that is going to help you with feeling less confused in these moments in which usually you have to take decisions, right? And you, in order to take a right decision, you will have to have a more clear mind. So the therapist is going to help with that. So the next reason why we should go to therapy is for personal growth. And yeah, so basically it is related to all the other points that I say before, but it's, I guess, more general. Personal growth is it's something that is on trend right now. And yeah, there are so many things that you can do. Of course, in YouTube there are so many gurus and people, creators, talking about habits and healthy habits that are related to um, different aspects of humans. It's not just mental health. Of course, they talk about different areas like physical. They say that you should take a shower of like they call showers, or that you should train more and you should eat healthier, and yeah, stuff like that. But I think, again, I think the mental part, like taking care of your mental health, controlling your mind and your thoughts and your emotions, it's very important if you want to really grow as a person. It's not just about changing in the outside. I do strongly believe that if you want to see a real change in the physical world, if we can call it that way, in our bodies and in our entourage, we need to change inside. And as I hear once, we basically need to take the trash out first. If first, um, like before starting your own journey, I think that is like a priority. Taking the trash out. And yeah, so that's one reason. The next one, if is that you should go to see a therapist if you are if you think, maybe you believe that you're suffering from a mental health disorder. So yeah, maybe you think that maybe you have depression, or maybe I don't know, bipolarity. Maybe you're bipolar by with the bipolar disorder. Sorry. Or maybe you think that you probably have uh, borderline disorder, and you just check out all the symptoms online. Or maybe someone told you, someone that you trust, from your inner circle, told you that you may need help, that you are like you have like several or some symptoms, so you should see a specialist. Yeah, and that's sometimes what it happens. It's I think it's important to go to a therapist because they can actually tell you if that is happening or not, with a test, for example. And yeah, that's one reason. So the next reason is that if you have um, mood swings, mood your mood changes very like strongly, and yeah, and that is like new to you. Yeah, like for example, you are very sad at some point, and it's just out of the blue and you don't know what is happening because you don't feel sad at all. Or maybe you are like having, I don't know, like having these moments in which you are euphoric and you're happy, but then you're also like doing crazy things or hurting others, and so you don't know what is going on. And maybe this is something that you have been experimenting for a long time, but there has been like a, I don't know, like a situation that was like the like too extreme, and you're like, okay, now I know that I need to look for help, ask for help. Or maybe it's something new. Maybe you have always been like emotionally stable, but now you're not. So yeah, yeah, that's a reason. Another reason. So next one is when you have physical issues that are not explained by the medicine, by doctors. So yeah, that's another one that is very important, because sometimes people, they have very, at their jobs, they have so many pressure and start like stressing or burning out, and some symptoms of that condition are related with, physical pain. And the most we can say that the first reaction to those situations is to go to a doctor. And I am not saying that that is wrong. It's okay. But sometimes it happens that the doctor is like, no, there is nothing going on. And I know that in some cases doctors, they can be that like, there is nothing going on and that's it. But sometimes they can be like, no, you need to see a therapist, you need to see a psychologist or a psychiatrist, because there must be something psychological, like the reason why you are in so much pain. And this can happen, like for example, some people that have stomachal issues, um, or headaches, for example. Yeah. So another reason why is when you have issues for being motivated and focusing, of issues for focusing on your work, on your classes. And yeah, this is also very important, for, because if you are having those issues, you are less likely to achieve your goals, and that can also make you depressed and anxiety. Honestly, all psychological constructs are related. That's something that we need to learn first. So yeah, when you're having through those issues, it is important to go to see a therapist, because they can make you understand like why is this going on, and they can also help you with different techniques. So the next one is, you should go to a therapist if you're feeling like you're stuck in a situation, like you're in a rut. So yeah, that's something that happens a lot. I mean, nowadays I think it's kind of frequent with people that are like students, or maybe they're already working and they feel stuck in a moment. Or maybe also happens with people that are entrepreneurs that have their own business. They can feel stuck, and and sometimes, yes, it's important to go with a therapist, because it can be related with your motivation, with being emotionally exhausted. It can also be related to some habits and lifestyles that you have, and like for example, lack of discipline. So yeah, that's one reason. So the next reason is when you don't find the purpose. You feel like your life is empty, is meaningless. You don't know what to do with your life. and this sadly again is getting very very common in among young people especially. And yeah, so this point I put it almost at the end because it's related to things that I've said before, with learning about yourself, with um, being more motivated. It's related about even learning about your past and learning about your your behavior and the the beliefs that you have. That is very important when you're looking for a purpose. So the final reason that I put into this list is for working on your social skills, and this is something that is very important. I think all of these reasons are very important. That's why I'm saying it a lot, because yeah, I mean every situation is different, of course, but when it happens, it's very important, right? So yeah, social skills are very relevant for humans because we're social beings, and sadly it's happening right now that so many people they're lacking of social skills. They're too into their phones. I feel like also there is an issue with empathy. People are not getting they are not becoming very empathetic right now. And yeah, so you can learn about it in therapy. So next I would like to talk about what to expect to the first sessions of therapy. So in the first one, you will have to explain about why are you going to therapy, about the main reasons why. Personally, I do like to ask my patients, like while we're talking on the phone, while we're like setting the first meeting. I do ask them about the reasons why they're seeking for help. So they usually send me a little text through the phone, and then during the first meeting is when we get to learn more about it, when I let them explain it more and go more into details. And I think it's very important to get to know the whole picture and to get to know the perspective that the patient has of their own issue and issues. And so also the first session, why is it so important? Because we have to, it's also the first meeting is where we're going to create this relationship, this rapport between the patient and the therapist, which is it's key, in the whole process of healing, because the patient needs to actually feel comfortable and actually like and trust in the therapist. It is just key for the healing process. So another thing that you should expect for the first seasons is that in those seasons, um, usually we talk about the conditions of the therapy, like um, the the cost of what they should pay, and like the payments, sorry, and the schedule, the the conditions. Like for example, in some cases, some therapists, they have different ways to work. They go to their patients' homes, or maybe they have they have like a physical office in which they can see their patients, or maybe it's all online. So yeah, it's a conversation that is important to have. Like I said, all the therapy's conditions will need to be established from the beginning. And so the next thing is, and it's something that is also not at the very first session, is basically establish the goals for the therapy. So yeah, maybe there is a reason, like a main reason why this person is going to therapy, but there can be other reasons that are not so, other issues that are not so relevant at that moment. So during the first sessions we can talk about it without getting too much into details. We can still like talk about it and make a list. So we can also talk about, okay, what can we do, and explain it to the patient. You can also explain the in this session we can also explain the kind of techniques that we are using. uh, Again, it's not the idea not is not to go into detail because we're going to do that later, but we can talk about you know uh, the type of techniques, the theories that we're using and all of that. And yeah, so there is just to finish this episode. I would like to talk about another thing that is a big question that some people have, and is that they usually ask if they will have to go to therapy forever. And so the answer, in my opinion, is no. No, you don't have to go there forever. Of course, every situation is different, every case is different. Some people may take longer, some people may not, and other people may actually they probably need to have a psychologist that is not um, like a constant communication with a therapist or with a group of mental health professionals in some cases, but in most cases it's not like that. In most cases, um, it doesn't take forever. Okay. And yeah, so another thing that I've learned that is very interesting is that going to a psychological therapy, it's kind of like going to a doctor, because when you have a depression episode, for example, and then you got healed, it doesn't mean that you're not going to have it again in your life. Okay, I know it's kind of confusing for people to understand, but it's I in my the explanation that I can say is that life is very challenging, and yes, we can grow with life, but we don't know what is going to happen next. And so at some point we can be like, oh my god, I'm so strong because I don't know, I was depressed when I was in high school, and now I am not, and I overcome that. I am more mature, and I am more wise. So I will never get depressed again. Well, that's not necessarily like that. You can get depressed. A teacher and another teacher also told me that being depressed is like like catching the flu. So you can get sick once, but doesn't mean that you are not going to get sick again. You know. And that's it for today. I hope you like it. I hope you found it useful. And I also wanted to say a little disclaimer is that English is not my first language. Okay, my first language is Spanish. And this is also the first episode of my podcast that is a bilingual podcast. And yeah, that's it. Welcome to my podcast. I hope you guys like it. Bye. See you soon.